I'm a registered dental hygienist in the state of Iowa, and I work in a practice in Des Moines. Anyway, I'm here today to talk to you about fluoride and why it's important and how to apply it and where you can have this done. Usually we ask our patients towards the end of their appointment if they would like a fluoride treatment today. Usually the first thing they say is, why do I need that and what is it for? Well, the main reason we use fluoride is to help prevent decay and also sensitivity in teeth. As we get older, we tend to have a lot of recession, and that recession causes some of the root of the tooth to be exposed. When the root of the tooth is exposed, it does not have the enamel layer on it and is much more susceptible to decay. So, is it important for elderly people, people in their 30s and their 40s, kids, teens? Yes, everybody. Your main cavity years are probably going to be 10 to 20 years old, but then that increases again as we get older. And think about the amount of time that those teeth are in the mouth. By the time you're 80 years old, your teeth have been there for 72 years. So any prevention is going to be great. This is the type of fluoride we use in our office. It's called a Fluoride Varnish. Easily applied, easy to apply. It takes literally 30 seconds. People can eat and drink when they're done with it. You should not drink very hot beverages or alcoholic beverages or eat really hard foods because that can remove it. For 4 hours, you should not brush. It continues to release fluoride for up to 24 hours. So we usually recommend patients wait at least 4 hours before brushing or flossing. One misconception there is about fluoride that it has to be applied after you've cleaned your teeth, whether after you brush, floss, have a cleaning in a dental office. That is actually not true. Most of your fluorides even are effective through plaque. So you can put them on teeth that haven't even been cleaned, which is super important, especially if you're in a setting such as a private practice. You can have fluoride available. You can apply it to children, adults. It doesn't have to be after dental cleaning. It doesn't have to be in a dental office. There are a lot of fluoride programs around the nation. They do school fluoride. They just go into schools and just apply fluoride on the kids' teeth. They have them in nursing homes. There's no reason why you couldn't also do that in private practice, general practice, physician assistants, nurses, doctors. It would be very easy to apply. Fluoride application is very simple. Very few things do you need. You don't need to be in a dental office. You don't even need to be where there is a sink. We have an applicator that is used to apply the fluoride, and then the fluoride usually comes in some sort of packet such as this. Usually we would like to have glasses on the patient or have them close their eyes just in case you would get any fluoride flying around. These would be operator glasses, A, so you can see better, and to protect the operator. Gloves, of course, personal protective equipment, mask to protect both the operator and the patient, and that's all it takes. We're ready to start with the fluoride application. First, we need to tear open the foil packet. Most of them come in some sort of package or something you have to peel a layer off. After we have placed it on a glove or a sticker or a paper towel, however you want to, make sure we mix it really well. It does separate sometimes in the package. We want to have a pretty thin layer on here. It doesn't take a lot of fluoride to be effective. And then the first thing we're going to do is apply along the tooth surface, along the gum line. Just a nice thin layer. We don't need to apply it on the gum tissue, although it doesn't hurt if you do. Close. We're going to take a little swallow or move the lips around. That hardens it on the tooth. Same thing on the other side. Thin layer right along the gum line. Close and move your lips around. Good. And open wide. Then we can do the chewing surfaces of the teeth also. You can go front to back or back to front, doesn't really matter. Just another nice thin layer. And then usually I do a small thin layer on the backs of these front teeth. Okay, close. And that's it for the top teeth. Okay. Now we'll go ahead and apply to the lower teeth. Same thing, right along the gum line, nice thin layer in a horizontal stroke, just running along that gum line. Then the other side. Now if the patient starts to get a lot of saliva, okay, close, move your lips around and swallow. You can have them swallow at any time. That just hardens it on the tooth structure, so kind of be watching for that. Then along the occlusal or the chewing surfaces again. Okay, close and swallow, and then again a thin layer on the backs of these front teeth. Okay, close and swallow. It usually has a fairly pleasant taste. It does leave a little bit of stickiness. You can kind of see a little bit of the coating of the fluoride on these teeth. They'll feel sticky to the touch and a little bit bumpy. That does come off after the patient brushes and flosses. We want to not brush and floss for a minimum of 4 hours. That fluoride is flowable, so even if you don't have it on one of the tooth structures, it is continually flowing throughout the mouth and getting on all tooth surfaces, so you don't need to worry about applying it everywhere. We want to avoid very hot beverages or alcoholic beverages because that will also shorten the time that the fluoride is effective. The other thing we want to make sure is that we're not brushing for 4 hours. You can not brush and floss for up to 24 hours, but most of your dental personnel don't really like that very much. We also want to make sure that we're not chewing real sticky foods. That'll just take it off. The fluoride is effective for 4 to 24 hours. As long as you leave it on there, it's going to be effective. Most patients will feel like they need to rinse or take a drink afterwards. Small sip of water is fine, but we should not use suction if you're in a dental office because it can clog the lines. And we also should not rinse just because we want to leave as much of that fluoride available as we can. You also want to be careful if they are rinsing and spitting into a cup not to pour it in the sink because it does leave a layer in the sink. So best thing is to just have the patient slightly swallow, move their lips around to harden it, and that's all you need to do.